Good afternoon, sir. I am Nicole M. Santos from BSN 1-2. So for today, I will going to perform a written demonstration on the neurologic system of the patient. So sir, sure, I start po. Thank you.
Come in.
Good afternoon po, ma'am. I am Nicole M. Santos po, a student nurse from Islayan University, Philippines po, and I am in charge to take care of you po starting 1 p.m. to 8 p.m. po. So, for safety purposes po, ma'am, may I hold your hand as I check your name brand? Kindly state your name and then your birth date po.
Friends Doodle M. Santos, September 2, 2009.
Okay, thank you po. So, I am here today po, ma'am, to get some tests regarding on your neurologic system, and the goal of this assessment po, ma'am, is we should to test the function of your cranial nerve and to detect if there are any abnormalities po. So before we proceed to the physical assessment po, is I will be asking some question lang po, if would be okay with you po, ma'am. Okay, thank you po. So, do you feel any pain on your back?
None.
On your head?
None.
Extremities?
None.
Do you feel or do you experiencing loss of consciousness?
None.
Loss of memory?
None.
Okay. Tingling?
None.
Numbness?
None.
Okay. Do you experiencing disorientation on time, place, or name po?
None.
Okay. So, do you have any problem on your taste po?
None.
Vision?
None.
Okay. In your hearing?
None.
Taste?
None.
Okay, that's great po. It's good to hear that po, ma'am. So, I will be closing the curtains for the patient's privacy. And I will be performing a hand hygiene to prevent the transmission of the microorganism. And I will be performing and I will be wearing my gloves for the safety precautions. Alright, so we can now start to the assessment of the motor function, specifically in the fine motor test of her upper extremities. So, before that, ma'am, I want you to imitate what I will be do. Okay po, ma'am? Okay, so for the finger to nose test, my patient will touch her nose using her index finger like this po, ma'am. Okay, the other side of your hand. Okay, thank you po. So, my patient can able to repeatedly and then rhythmically perform the touch of her nose. Okay, next is to the finger to nose to nurse's finger. My patient will touch my index finger and then her nose. Okay, just touch my index finger and then your nose. Okay, other side of your hand. Try quickly as you can. Okay, thank you. So, my patient can able to perform it rapidly with coordination and then with ease, which is great. So, next is for the finger-to-finger test. My patient will touch my finger once again. Okay, just touch my index finger, ma'am. Okay, try quickly as you can. Okay, the other side of your hand. Okay, thank you po. So, my patient can able to perform it rapidly with accuracy. So, we can now proceed to the finger to thumb test. My patient will touch each of her thumbs on the same hand. Okay, ma'am, just like this. Okay, the other side of your hand. Try quickly as you can. Okay, thank you po, ma'am. So, my patient can able to touch each of her thumbs on the same hand with rapidly, which is normal. So, next is to the alternation of the supination and then the pronation of or her hands on me. Okay, just place your hands on me. Okay, just turn it on the supination and then pronation. Okay, try as quickly as you can. Okay, ma'am, thank you po. So, my patient can able to perform it rapidly and smoothly, which is good. So, we can now proceed to the gross motor and then the balance test. Okay, so for the walking gait, my patient will stand and walk several times without any support from me. Okay, just stand and then walk. Okay, thank you po. So my patient can able to stand and walk without any support from me or from the others. So for the Romberg test, my patient will place her arms on the side and feet together. Okay, I will be observing it at least 20 seconds. Okay, with eyes open. With eyes closed. Okay, so just stay in that position, ma'am. I will just slightly push you to test how you regain the balance. Okay, that's it. So my patient can able to maintain upright posture with foot stance, which is good. So next is for the standing one foot with closed eyes. My patient will lift one of her legs and then standing one foot with closed eyes. Okay, standing one foot and then close your eyes po. I will be observing for at least 5 seconds on each. Okay, the other side. Okay, thank you po. So, my patient can able to maintain stance for at least 5 seconds. So, for the heel to walking, my patient will walk on a straight line while placing the heel directly in front of her toes on the other feet. Okay? Okay, ma'am. Just walk in the straight line po. Okay, thank you po, ma'am. So, my patient can able to walk on the heel to walking, which is normal. So, for the heel or two walking, my patient will walk several times using her heel and then her toes. Okay, in her heel. Okay, thank you. Okay, in the toes. Okay. So, my patient can able to walk on her heel and in her toe, which is good. So, we can now proceed to the mental status. Okay, ma'am, please sit down. Okay, for the level of consciousness, I will be asking my patient. Okay, ma'am. So, what is your name po?
Friends Eugene Santos.
What is the name of your father and mother?
Amelia Santos, Lorenzo Santos.
Okay, thank you po. So, my patient can answer all the questions without any confusion. So, for the cognitive function for me to be able to test it is I will be asking her again a few questions. Okay, regarding in her recently, remote, and then the intermediate memory. Okay, for the recent memory, what are you eating on your breakfast po?
Hotdog and rice.
Okay, what time are you awake po?
Okay.
6:30.
6:30.
Okay, thank you. So, for the remote memory, so, do you have any surgery in the past 4 years ago?
Yes.
What kind of it is to?
Appendix.
If you don't mind po, can you tell me or share ano po yung mga nangyari that time or yung naranasan niyo po?
Masakit po yung ganito at saka po yung ako naiyak na mami ko.
Okay po, ma'am. Thank you. Okay, for the intermediate memory naman po is I will be saying a 5 series question po and then just repeat it after me po. Okay? Okay. 5, 8, 6, 2.
5, 8, 6, 2.
Okay, that's great. So my patient can able to do all the question and can able to answer all of that without any confusion, which is good. So we can now proceed to the assessment of the cranial nerve. Okay, for the cranial nerve 1, which is the olfactory, I have here a different aromas. My patient will distinguish or identify what kinds of aroma it is. Okay? So, ma'am, please blow your nose po to wipe out if there are any mucus. Okay, thank you po, ma'am. So, please occlude one of your nose po and then close your eyes po. And then tell me what aromas it is.
Okay.
Okay. Okay, one side of your...
Alcohol.
Okay, that's great. So, my patient can able to distinguish all the aromas I placing on her nose. Okay, so next is the cranial nerve 2, which is the optic. So, can you please stand, ma'am? And I will be turn. Okay. Please stand sit again. Okay. I prepare a Snellen chart in front of her. All she need to do is to read it. Okay. Please cover one of your eye po.
E, D, C, B, A,
Okay. Other side of your eye cover. Okay.
E, C, B, A, D.
Okay. Thank you. So, I will be inspecting for the pupil for its size and alignment of the patient. Okay, just look at me and focus on me lang po, ma'am. Okay, upon observation and inspection, the pupils appears has a normal size and alignment. Okay, for the pupillary reflexes, I have here a pen light to shine the eyes of the patient. So, ma'am, it is okay to shine your eyes po. Thank you. Okay. So, my patient has no abnormalities on the pupils, and then the dilated and constriction happen in the dim and then the light test. Okay? So, for the swing light test, it may reveal the relative abnormalities on her eyes or the pupillary. Okay, I will be shining your eyes once again po, ma'am. Okay? Okay. Upon observation and shining her eyes is I haven't seen any abnormalities in her pupillary, which is good. So, we can now proceed to the cranial nerve 3 and 4, which is the oculomotor and then the trochlear. Okay, I will be doing the 6 cardinal position, and all you need to do po, ma'am, is to follow my fingers. Okay, and then blink po. Okay, do you have any double vision? Okay, that's great. So, for the cranial nerve 5, which is the trigeminal, okay, I have here a clean tissue and I will touch the sclera of the patient to elicit the blink reflex. Okay, ma'am, it is okay to touch your eyes. Okay, so for the light sensation, I have here a cotton whisk. Okay, ma'am, here's the feel the cotton whisk. Do you feel it? Okay, and then close your eye and then tell me if you feel the cotton on your forehead and the paranasal sinuses. Okay, open your eyes. Do you feel the cotton pop inside you? Okay, that's great. Okay, for the deep sensation, I have here a tip of my ball pen and here's the feeling po of the tip of the ball pen. Do you feel it po? Okay, can you close your eyes again? Okay, do you feel it, the tip of the ball pen on your forehead and the coronation sinuses? Okay, that's great. So, for the cranial nerve 6, which is the abducens, so I will be doing again the 6 cardinal position and my patient will follow my hand without moving her head. Okay? Don't move your head po, okay, while following my finger. Only your eyes. Okay, that's great. So my patient can able to do it without following her head. So for the cranial nerve 7, which is the face, is my patient will going to raise her eyebrows and then smile and then frown po, okay? Raise your eyebrows po, okay? And then smile without showing your teeth po. Smile po kayo without showing your teeth po. Okay, that's great. So, can you frown po? Okay, can you puff your... Okay, that's great. So, I have here a different case and I will be placing the tip of the side of her tongue. Okay. Okay, can you stick out your tongue po, ma'am? Stick out po. Okay. Okay. Do you taste it po, ma'am? Okay. Can you tell me what taste it?
Sweet, saka po maalat.
Okay, that's great. You still distinguish the taste. Okay, we can now proceed to the cranial nerve 8, which is the auditory. Okay, can you cover one of side of your ear po and I will be whispering po. Okay, cover your one ear. Okay.
89.
Okay, okay, cover your... Okay.
96.
Okay, that's great. So, I have here a tuning fork to test the ring test, okay? Just tell me if you hear it, okay? Okay, I will be placing here in the bone behind of her ear. Okay. Do you hear it? Okay, tell me when it is stopped.
Stop.
Okay, that's great. So, we'll be going to place here and the forehead of the patient. Okay. Okay, do you hear it? Okay, saan po yung mas malakas? Sa upper or middle or lower part?
Middle.
Okay, that's great. So, we can now proceed to the glossopharyngeal of the patient. Okay, I have here a tongue depressor. Okay, ma'am. I will be inspecting for the soft palate and then the uvula of the patient. Okay? Can you open your mouth po and then stick out your tongue po and then say ah. Ah. Po. Ah for a very long time. Ah. So, my patient, there are no abnormalities in the soft and the uvula of the patient, and the uvula is in the midline and it is vibrating when she say ah, which is normal. So, we can now proceed to the assessing of the vagus of the patient. So, ma'am, if you don't mind po, I will be asking once again, or can you repeat what I will be saying na lang po to test your hoarseness. Okay? I am beautiful.
I am beautiful.
Cell phone.
Cell phone.
Okay? There are no abnormalities on the hoarseness of the voice of the patient, which is good. So, we can now move on to the accessory of the patient. So, this is the po. Okay, so please, I will be asking my patient to shrug her shoulder and then try to resist when I push it down. Please shrug your shoulder. Okay, so I will be placing my one hand on your face and try to resist against my hand. Okay po? Okay. Alright. Okay. So, my patient can able to resist the strength or the force that I've applied, which is normal. So, we can now proceed to the hypoglossal of the patient. So, ma'am, can you protrude or sticking out your tongue po? And then move up and down. And then side to side. Okay, brilliant. So, my patient can able to move her tongue without any difficulty. So, I guess this is the end of the assessment in the neurologic. But before that, I will be asking my patient if she feel anxiety or any discomfort while we are doing the assessment. Okay, ma'am? Do you feel any discomfort po ba habang ginagawa po natin yung mga test or assessment na ginawa natin kanina po? Wala na. Okay, that's good to hear that po, ma'am. So, thank you po, ma'am, for your fully cooperation with me po. And then, I will be referring you to Dr. Uy for the further evaluation. And I will be document all the findings. But so far, based on the assessment we've done today is the findings is all normal. Okay? Thank you.